Good afternoon. Today our lecture would be on schistosomiasis. So schistosomiasis, be it acute or chronic, is caused by parasitic worms. And people are usually infected during routine, agricultural, domestic, occupational, and recreational activities, exposing them to infected water. The lack of hygiene and certain play habits of school-age children, such as swimming or fishing in infested water, makes them especially vulnerable to infection. So schistosomiasis control focuses on reducing disease through periodic large-scale population treatment with praziquantel and a comprehensive approach including potable water, adequate sanitation, snail control would also reduce transmission. Estimates show that at least 206.4 million people require preventive treatment for schistosomiasis in 2016, out of which more than 89 million people were reported to have been treated. Preventive chemotherapy for schistosomiasis, where people and communities are targeted for large-scale treatment, is only required in 52 endemic countries with moderate to high transmission. Infection sets in when your larval parasitic forms get released by freshwater snails. They then penetrate skin during contact with infested water. Transmission occurs when people suffering from schistosomiasis contaminate freshwater sources with their excreta containing parasite eggs which hatch in water. In the body, larvae develop, and these become adult schistosomes. Adult worms live in the blood vessels, then the females release eggs. Eggs are passed out in feces, urine to continue the parasite's life cycle. Others become trapped in body tissues, causing immune reactions and progressive damage to organs. Schistosomiasis is prevalent in tropical and subtropical areas, in poor communities without access to safe drinking water and adequate sanitation, and it is estimated that at least 91.4% of those requiring treatment for schistosomiasis live in Africa. There are two major forms of schistosomiasis. This is intestinal and urogenital, caused by 5 main species of blood. So these are the parasite species and geographical distribution of schistosomiasis. Intestinal schistosomiasis are caused mainly by the 4 species, namely Mansoni, Japonicum, Mekongi, Guinesis, and Intercalatum. Geographical distribution would be the following. Of note would be urogenital schistosomiasis, which is caused mainly by Schistosoma hematobium. This is distributed in Africa, the Middle East, and Corsica. Again, it affects poor and rural communities, particularly agricultural and fishing populations. Women doing domestic chores in infested water, such as washing clothes, are also at risk and can develop female genital schistosomiasis. And inadequate hygiene and contact with infected water make children especially vulnerable to infection. Migration also contribute to the cases of schistosomiasis. So this migration would introduce the disease to new areas. Increasing population size and the corresponding needs for power and water often result in development schemes and environmental modifications facilitate transmission. So with the rise in ecotourism and travel, increasing numbers of tourists are contracting schistosomiasis. At times, tourists present severe acute infection and unusual problems including paralysis. Urogenital schistosomiasis is also considered to be a risk factor for HIV infection, especially in women. These are caused by the body's reaction to the worm's eggs. Intestinal schistosomiasis present as abdominal pain, diarrhea, blood in the stool, liver enlargement, and these are in advanced cases frequently associated with an accumulation of fluid in the peritoneal cavity and hypertension of the abdominal blood vessels. In such cases, there may also be enlargement of the spleen. The classic sign of urogenital schistosomiasis is hematuria. In advanced cases, there could be fibrosis of the bladder and ureter and kidney damage. Bladder cancer is another possible complication in the later stages. In women, they present as genital lesions, vaginal bleeding, pain during sexual intercourse, and vulvar nodules. In men, they could present as the pathology of seminal vesicles and prostate disease. And this may mean long-term irreversible consequences such as fertility. Economic and health effects makes the disease more disabling more than it kills. In children, it gives you anemia, it stunts your growth, and gives you the reduced ability to learn, but reversible with treatment. Chronic schistosomiasis may affect people's ability to work and in some cases can result in death. The number of deaths due to schistosomiasis is difficult to estimate because of hidden pathologies such as liver and kidney failure, bladder cancer, and ectopic pregnancies due to female genital schistosomiasis. Death estimates due to schistosomiasis need to be reassessed. So it varies between 24,000 to 200,000 globally per year. In 2000, WHO estimated the annual death rate of 200,000 globally. This should have decreased considerably due to the impact of a scale-up in large-scale preventive chemotherapy campaigns over the past decade. Detection of parasite eggs in stool or urine specimens and antibodies detected in blood or urine samples are also good indicators of infection. For urogenital schistosomiasis, a filtration technique using nylon paper or polycarbonate filters is the standard diagnostic technique. In hematobium, almost always they have microscopic blood in their urine which can be detected by chemical reagent strips. The eggs of the intestinal schistosomiasis can be detected in fecal specimens through the Cato-Katz technique. They are methylene blue stained cellophane soaked in glycerine or glass slides. For people living in non-endemic or low transmission areas, serological and immunological tests are useful in showing exposure to infection and the need for thorough examination, treatment, and follow-up. So, lessons of prevention of control can be shown in different countries such as Brazil, Cambodia, and China, Oman, etc., and transmission interruption. and these are usually controlled through large-scale treatment of at-risk population groups, providing access to safe water, improved sanitation, hygiene education, and snail control. So strategies used is focused on preventive chemotherapy. This reduces disease by praziquantel treatment. So it is periodic, targeted, large-scale in scope to affected populations. So it involves regular treatment of all at-risk groups. So when there is low transmission, the interruption of the transmission of this disease should be aimed for. Frequency of treatment is determined by prevalence of infection, especially in school children. In high transmission areas, treatment may have to be repeated every year for a number of years. Monitoring is essential to determine the impact of control interventions. So strategies would be to reduce disease morbidity and transmission. So as mentioned, we have periodic treatment of at-risk populations. Major limitations, however, to schistosomiasis control would be the limited availability of the drug praziquantel. This is 2016 data. Around 35.6% of people only were required treatment were reached globally, with a proportion of 53.7% of school-age children requiring for preventive chemotherapy for schistosomiasis being treated. So you have to target school-age children, adults that are considered to be at risk in endemic areas, and people with occupations involving contact with infested water, such as fishermen, farmers, irrigation workers, and women whose domestic tasks bring them in contact with infested water, and entire communities that live in highly endemic areas. So praziquantel is the recommended treatment against all forms of schistosomiasis. It is effective, it is safe, and low cost. So even though reinfection may occur after treatment, the risk of developing severe disease is diminished and even reversed when treatment is initiated and repeated in childhood. School-aged children in endemic areas are targeted, again, adults considered to be at risk, and entire communities living in highly endemic areas. So this is the life cycle of your schistosomiasis according to the CDC, and you have learned in microbiology. Thank you for listening. Please do subscribe to our PMCH JFSM YouTube channel for more lectures on preventive medicine and community health. Thank you.